Dr. Miller, what do you say is the state of America's fight against cancer?
Well, I'd say that right now the state of America's fight against cancer has been very similar to what's been going on for the past 25 years. We've been spending a lot of time trying to make people understand, just as Dr. Newman just mentioned, about the importance of coming in, talking to your physician about your risk factors, getting screened, and ultimately getting the treatment for the cancer. So the state now is, we've gone a long way. We have decreased some mortality or some deaths from a lot of cancers, but there's still a lot of people dying from the cancers unnecessarily. So we still have quite a ways to go to show much improvement in those deaths from cancer.
Dr. Miller, that's a really good point. Let me ask you this. I, as a surgical oncologist, typically think of my colleagues at the National Cancer Institute leading the fight against cancer. I think it would be really wonderful for you to share with us how the Center for Disease Control sort of leads that fight here in the U.S., probably involving things like the breast cancer early detection, cervical cancer. Can you elaborate for us?
Yes, that's a good question because people always get us all confused at the federal level.
Right.
What CDC does several things in that charge. One of the premier things we do is our National Breast and Cervical Cancer Early Detection Program. What a lot of people know is the BNC program, or the Breast and Cervical Cancer Program. That program, it's targeting women who would be in our disparity range, the women who would not have access to care, the women who would not be able to afford getting the appropriate screenings, getting the appropriate treatment. So our program, realizing 20 years ago that there was a real problem that these uninsured women, low-income women, did not have access to care, it provides a way for these women to actually get the access that they need. We actually provide free or low-cost screening for both breast and cervical cancer. That includes all the diagnostic testing for those who are found to be abnormal with any of their screening tests, all the way to final diagnosis. And we also then have a referral to the breast and cervical cancer treatment program, which is through the Medicaid in each state. And for all women who are diagnosed with cancer through their program, they can actually get their treatment provided through that program.